Hi, today I'd like to talk about how to do an insulin injection. As a credentialed diabetes educator, I teach people how to do insulin every day of the week. Sometimes I think to myself, I wonder if you're getting this. Anyway, this video will allow you to review how to do an insulin injection. Make sure you're doing all the steps right and, brush up your technique if you need to. The first thing you need to do is get your insulin. So this is a disposable insulin pen. Not all insulins come in disposable insulin pens. You've got to remember there's many different kinds of insulins on the market. Some come in disposable insulin pens, other comes in reusable insulin pens. It just depends. The basic injection technique is the same for all of them, so you don't need to stress out about that too much, but just keep in mind that things vary. First thing we do when we're going to do an insulin injection is to wash our hands with soap and water. Always wash your hands before you start. The second thing is to make sure you're giving the right insulin at the right time. As I said before, there's a variety of brand names and different insulins which work in the body in different ways. You want to make sure you're giving the right one at the right time, because if you don't, you can cause yourself all sorts of problems. So this one happens to be Lantus. I've got some other examples here. This one's just an old demo pen. This one is called Humalock Mix 50. I want to show you something. See how this one's all cloudy? When you look at this one, if I can find it, when you look at this one, up here, the insulin is all clear. So some insulins before you administer must be mixed. This is a good example of a clear insulin. See how it's clear and see how this one is cloudy. Mixed insulin, you must mix it up before you do. Before you give it. If you don't, what happens is when the insulin is sitting there for a while, the particles all separate out, and if they're not mixed before you administer it, the insulin's not going to work in your body correctly. So make sure if you're using a mixed insulin that you mix it correctly. I'll show you how to do that when we go towards doing your injection. So when you've opened an insulin pen and you're using it, it stays out of the fridge. You don't put it back in the fridge. You store it out. Once it's been open and in use, most insulins have to be thrown out after about 28 days. There's some newer ones that have come onto the market. They've got a longer lifespan out of the fridge, 45 days. But you need to check with your pharmacist to make sure when an insulin needs to be thrown away. Because if you're only taking a small amount of insulin every day, it's possible that you'll need to throw out the insulin that's left in the pen and grab a new one out of the fridge every so often, so that you're making sure that your insulin is going to be working effectively for you. So let's get started. I'm just looking for an insulin needle here. So to do an insulin injection, we need to take our insulin, wash your hands with soap and water, check that you're giving the right insulin at the right time. I have known for the local pharmacy to dispense the wrong insulin to people. This causes all sorts of problems. So you make sure that you are giving the right insulin at the right time so that you're not running into any issues. I'm going to use the mixed insulin for this one because I want to show you how to mix the insulin. So remove the paper off the needle, and we use a new needle every single time. We do not reuse needles, and we do not store the needle on the insulin pen. We put it on when we're ready to use it. So screw it on. It's kind of like a screwing, pushing sort of motion. Just do it fingertip tight. You don't need to over tighten it because you're going to be taking it off shortly. Then I want to show you how to mix the insulin. So you've heard of rock and roll. We roll and rock. What I mean is we hold our pen like this and we roll it in between our hands, rolling, rolling, rolling for about 10 times, 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. And then we rock it like this. About 10 times. Did you count? I didn't. You can see how I'm rocking it very thoroughly. Now, when we look at the mixture, Can you see how well mixed it is? Good, isn't it? Whereas this one here, the clear insulin, we don't need to go through all that rigmarole of rolling and rocking, okay? So my recommendation to you is to understand the insulin you're taking and know whether or not you need to mix it thoroughly before you give it, okay? That's going to be on you to check out on that. Then we remove the lid. So these insulin needles come with two lids, a big lid and a skinny lid. So this lid is the one we need to keep, so keep that one. However, this other covering, we take it off and we remove it and we throw it away. We're not going to use that again. And I'm trying to get up nice and close so you can see how big that needle is. It's very small, can you see? I'm not sure if you can see, but it's very, very small. Don't fear the insulin injection because the needle is actually very tiny. Most people that I've ever spoken to about this say they can't even feel it going in. So don't be stressing out about that. Next, we're going to dial 2. Every single time we put a new needle on, we need to prime the needle. We need to make sure the needle is going to work for us. So we dial 2 units and we waste 2 units. To waste it, you just put your finger on the dial down here on the little plunger dial here and push your insulin up through needle. Can you see the insulin coming out of the end? So now we know that the insulin is working, like we know the needle is working and we've got the insulin fully primed. We've pushed the dial and it's gone back to 0. The next thing we need to do is dial our dose. So today, I don't know what your dose is going to be. Insulin is in a medicine that every dose is different for every individual person. It varies and you need to know what your doses are before you start, okay? And keep in mind too that those doses over the years, over the weeks, whatever, may change. That's normal. So let's just, for the sake of today's discussion, we'll dial 10. We'll say our dose of insulin today is 10 units. So let's dial the dial around to 10. And you can also hear the clicks and you can see it's number 10. Then I'm going to hold my pen like this. I like to hold my pen like this so I can put my thumb on the dial. I can see the numbers. I'm going to take my pretend tummy because I'm not going to put it in my actual tummy today because this is a demonstration. You, if you were doing an actual live insulin injection, would be putting it into your body. I'm not going to do that. Then I'm going to hold my pretend tummy and see how I'm taking my needle at a right angle. I just insert it gently at a right angle. No need for pinching or pulling or anything like that. Gently insert it and then using your thumb, push down on that dial until it comes to 0 and then wait and count to 10. 10, 9, 8, 7, 6, 5, 4, 3, 2, 1. Then remove it. And this is why we kept the big lid. We're going to cover the big lid and we're going to remove our needle. As soon as we're finished, we don't want to leave the needle sitting there on the end of the insulin. Remove it. And then put the lid back on the insulin. Don't leave the lid off because insulin is degraded by sunlight. So keep your lid on your insulin. And then put it in a nice, cool place, but not in the fridge. Once you've finished using it, put it in the pantry with the lid on, something like that, where you can grab it ready for next time. So that is the key way of doing an insulin injection. A few little important factors. Where are you going to inject your insulin? In general, I teach people to use their tummy. There are many places on the body that you can use to inject insulin, but especially if you're just learning insulin, I like to teach the tummy because it's easy to see, you know, you can see what you're doing, and it's a good place to get your confidence up. If you'd like to know about the other places on your body where you can do your insulin injections, let me know and we'll make a video about that in the future. for now, let's just talk about the tummy. So the key point when doing insulin injections is that you must not put the insulin into the same place over and over again. You must rotate the site. I'll show you what I mean. So in the tummy, if we're using our tummy, we would find our belly button and we would stay 2 finger widths away from the belly button. So don't go too close to your belly button. Stay away from this area. Then every time we do an injection, we can use our whole belly. So we can go all this area and all this area. We can even come out here. Every time you do an injection, go into a slightly different place. See how I'm moving away? And you can come out here and use this whole area. If you can reach out here, you can use it. So take a couple of techniques for rotating the injection site. You can go around in a circle, like a clock face, getting bigger and bigger. So you've covered the whole belly. Or you can go like in a zigzag, like this. Yep. I don't mind. Whatever works for you, whatever helps you remember to keep rotating your injection sites, that's fine. Do not fall into this trap. This is super important because this is a trap that I see many people fall into. They think they're rotating their sites, but actually they're not. They go, oh, morning, I'll go here. Afternoon, I'll go here. Backwards and forwards. Basically, they keep going into the same place. They're just alternating the sites. So don't be doing that. Make sure, ooh, get your zigzag happening or get your clock face happening. Don't go back into the same place too many times. Let me just double check. Yeah, I've got this step-by-step guide on how to do insulin. Here it is. Let me know if you'd like me to attach that to the bottom of the video. If you do, I'll put it down so you can refer to it. I suppose when you're doing your insulin injections, oh, did I say about washing your hands with soap and water before you start? I hope I said that because, you know, that's really key too. Yeah, if there's any topics you'd like to talk about on Talking Diabetes, please let me know. This is a general video, it's general information. Please be aware that everybody who has diabetes is an individual and we must look at the individual situation and tailor our management to individual people. So this video is not intended to apply directly to each individual person. It's a general video. Just keep that in mind, and thank you for watching Talking Diabetes. Talk to you next time. Please let me know if there's any topic that you would like to discuss and I'll make a video. Thank you.